Hey everyone, I hope you guys are doing well. Some of you may have just started nursing school, some of you are starting a new quarter, and I've been thinking about you guys, praying for you guys. Hope that either if you're just starting or you're about to start your first week is going well, or has gone well, or will go well. I kind of just wanted to make this video with just a couple tips for studying that I have. Some things that I found as I've gone through nursing school that is helpful, or some things that I found make studying or memorizing easier. One thing with memorizing information, you don't want to just memorize for a test to then forget it. You want to memorize things or find things that help you memorize different medications or processes or, changes that are happening in the body for the NCLEX. So you need it in your long-term memory, not just your short-term memory, something that you're going to remember and forget. And coming up with acronyms to remember things by or different ways, they could be funny ways, just something to remember them by, can be very helpful and beneficial along the process. So one of the first things I want to mention about studying is writing things down, writing notes, taking notes, rewriting things from your book. One of my teachers last quarter was telling us, and I really do believe it, but she was saying that writing stuff down helps in remembering, and they found that like 70% of cases, 70% of the things that students were learning that they wrote down, they remembered, versus things that they learned and then didn't write down. So one of our teachers last year, computers technology was off limits in her class, and you could just take handwritten notes. So to help with that a lot too is she would print off the PowerPoint she was going over, and then we had to write our own notes down or write things down that she said. And I did find that was very helpful. A lot of times they say that writing something down once is like saying it out loud 7 times. And I don't know if you guys have heard, but when you say something or do something for 7 times in a row, you remember the process, you remember what you said, you remember it better. So she had us write our notes, and I did find that it did help. A lot of times when I would go back and studying, I'm like, oh yeah, I remember this, I wrote it down, and then I can walk through the process and explain it to people, or just for my own, knowledge of remembering. Another tip that I would give you when you're studying, if you're just starting, if you're about to start, or you're starting in the near future, something that helped me, especially in pharmacology, I almost wish I had done it more in pharmacology. I didn't so much as do it. I used the brand names or generic names rather than learning both names. I just focused on the name that was in parentheses. So for diuretics, Lasix, I remembered the word Lasix rather than furosemide. And what I'm finding now, a lot of the times on our ATI proctored exams and on exams in general, is they're not using the term Lasix, they're using furosemide. So something that I would strongly suggest is, if you're haven't started yet or about to start, is memorizing both names of the drug, because some exams they'll say Lasix on them, whereas some will say furosemide. And it's the same thing, but that can trip you up if you're, memorizing Lasix and all you see is furosemide on the test, and you're like, well, what is this? If it's asking for signs and symptoms or toxicity levels, or, what to be aware of, what are contraindications, if you only know the one word, you may be getting a question wrong. So that's something that I've definitely been seeing on the ATIs, is they're using furosemide instead of Lasix. They're using that word that's not in parentheses. So if you're just starting nursing school or just starting pharmacology or about to go into pharmacology, something I strongly recommend is starting now, learning both names of the drugs. It'll help you out a whole lot in the future. especially when it comes to taking those ATI exams, because they do tend to use sometimes both names. Along going in with pharmacology, even not with pharmacology, I know I just started this in pharmacology and I don't think I've ever talked about it on the videos, but something else, when you're memorizing medications, or when you're, well, memorizing medications, we'll go with that first. Memorize like them in the groups, know the groups, because each group of medications has something similar within each name of the med. So, like ACE inhibitors are, and their names end in prils. So every drug or most drug medications, I guess I should say, that are ACE inhibitors, their drug ends in pril. Benzos, their drugs typically end in lam or pam. And there's a little saying too that says, Lam and Pam ride fast in the Benz and lock Barbie in jail for 3 to 5 days. And that is a, little catchy phrase that I use to remember that barbiturates and benzodiazepines are, work for anti-anxiety, sedation. They tend to work faster than barbiturates. So Lam and Pam, which are the suffix for most drugs that are benzodiazepines, Lam and Pam ride fast in the benzodiazepines, Benz train, whatever. They ride fast because they start working on the body faster. And they lock Barbie in jail for 3 to 5 days. Barbie stands for barbiturates, and it helps remind me that barbiturates work in they take a longer time to work. 3 to 5 days is, faster than 1 to 2 days, like benzodiazepines. So, whereas benzos, they can work fast. They're a good, like emergency or go-to drug, and then barbiturates are more of a maintenance drug and keeping it up because they take longer to have the same effect. Coming up with things like that to remember drugs by or whatever is very helpful. So finding what those endings are. Another one is Metoprolol. What is that? Metoprolol, I just went blank, is a Metoprolol. Beta blocker. Sorry. Metoprolol is an example of a beta blocker. Most all beta blockers end in OLOL. So that's how I remember it, is if it ends in OLOL, yes, OLOL, it's a beta blocker. And so then I can see, okay, this ends in an OLOL, it most likely is a beta blocker. If it's a drug that I've never seen before, I can use these techniques and things that I found that, drug classifications have in common to help me answer questions. And 99.8% of the time, I'm getting those questions right on an exam, even if it's a medication I've never seen, because I'm able to break down the word and kind of figure out what class of medication it goes to. And then, if it's a signs and symptoms question or an adverse effect, I know the category that it's kind of in to know, okay, this is a possibility, this is definitely not it. Breaking it down into if it's anticholinergic or cholinergic. It just is helpful in remembering what drugs do what, which classification of drugs it might fall into. So finding something like that as far as drugs go, can be very helpful in studying as well, and in answering questions on, future tests you might have. Kind of along with that, not necessarily just for medications, for anything that you're studying, finding mnemonics to help you remember what they are. Finding words that you can use to help, like with signs and symptoms of drugs and things. Not just drugs, but also overall categories can be very helpful. So for an example of overall category, we were learning acid-base, alkalosis, alkaline, and trying to remember each. And one of the acronyms is ROME, and it stands for respiratory, opposite, metabolic, equal. And it just helps you remember which way, pH or metabolic are going, which way they're going within those functions. And if that's not something you've gotten into, it doesn't make a whole lot of sense now, but it will once you've gotten into it, or if you already are in it, you've gotten that far, you understand kind of what I'm talking about. Finding little acronyms like that have meaning that go along with what you're studying is helpful. Another thing is with, we were learning last quarter fluid and electrolyte balance with the acid base. So coming up with the signs and symptoms, a lot of those fall under very similar categories. I actually have those notes here I can show you. I came up and found and was looking for words to help me remember what each category of electrolyte stood for. So I made these little acronyms. Some of them have acronyms on them that you can see to help remember what they went with. So for sodium, hyper and hyponatremia, or high or low sodium, I found an acronym for hyper, and the acronym is SALT, S-A-L-T, and that stands for skin flush, agitation, low-grade fever, and thirst. Those are some of the signs and symptoms of hypernatremia that are different than some of the other electrolytes that we were learning. And of these, I just have sodium, potassium, phosphate, chloride, calcium, and magnesium. But then for hyponatremia, I wasn't able to find a acronym or a word to help me memorize it, so I just put bounding pulse, hypotension, and edema or weight gain. And I just have kind of been able to remember that. I remember salt, and then I just remember what hypo is. For high potassium, I came up with the acronym MURDER, and that stands for muscle weakness, urinary abnormalities, respiratory depression, decreased cardia, EKG changes, and reflexes. And then for hypo, I came up with A, sick, WALT. So A stands for alkalosis, S stands for shallow respirations, I, irritability, C, confusion, W, weakness, A, arrhythmia changes, L, lethargy, and T, thready pulse. So I just came up with words that helped me remember different electrolytes that I needed to know for my exam. And those can be so helpful because sometimes it's just an overwhelming amount of information that your teachers expect you to know, and you look at something and you just think, there's no way I'm going to be able to remember all these different signs and symptoms for all these different classifications of medications, or all these electrolytes, or all these things that the teachers want you to memorize for your exam in 2 weeks. So finding little things like that to help you remember things can be very beneficial. It doesn't work for everybody, but for some people it really does help them in remembering and keeping, different categories or different things separate. Coming up with funny things, if you're in a study group when you guys are talking, funny ways to remember different things, you remember that stuff, and then talking about it helps you remember it as well. So I highly, highly recommend coming up with little mnemonics or acronyms to remember different category of drugs, different classifications of information that you're supposed to be learning. Something else that I found that helps with studying is not so much as like a tool, but things to help with actually studying and getting. One of those is getting into a group of friends. And I know I've mentioned this before, but I have time and time again felt like that has saved my butt on so many things, because I'm able to talk things out with my group of friends, and typically there's only 3-4 of us that meet pretty much on a daily basis to study. And one of the reasons that it's such a small group is that we find that if it gets too big of a group, and if every once in a while before exams we'll study in a bigger group for a short amount of time, and then we'll go back and just study in our group of 3. But we found that once it gets bigger than 4, typically you end up talking more about topics that are irrelevant, and you get off topic very easily, and then you're just wasting time that you could be using to study, and ultimately that could be the difference between 1 or 2 questions on the exam, which could be the difference between an A or a B, or a B and a C, or whatever it may be that you're, on the border of. So that is one reason why we like to keep such a small group, is because we are able to stay on focus more. However, saying that, there's a couple different parts that I want to bring up that go with that. One of them is that you still need to take time to take a break. It's been shown that after about 20 minutes of work, your brain just shuts off, and you're reading a line in your textbook or in your notes, and you're reading it over and over, and you get to the end of the page, and you have no idea what you just read. Nothing has stuck. So studies have actually shown that after about 20 minutes, it's good to take a 5 or 10 minute break and then get back into studying. So a lot of times with our group, when we're studying, and then we get off topic, and it's like, okay, so it's not like a 5-minute off topic. We get off topic, we're talking about something, and then we get right back into it. But our brains need that kind of change in stimulation, or after 20 or 30 minutes of, discussing things or quizzing each other, we'll get up and walk around the house or the building or wherever we are just to do something, get away, put, your mind on something else, and then come back and get into it, and we're remembering the information better. So I definitely, although I am suggesting, getting in a group or studying on your own, take those breaks. Go do something. Every, break you're going to pick up 10 things around your house. You're going to clean the bathroom. Don't make it like a 3-hour clean the bathroom or clean the living room, but, on your breaks, throw in some laundry. On your next break, move it to the dryer. Get up and walk around, get those brain juices flowing, but also give your brain time to take a break, and then remember that information. And if you don't, and you study for 4 hours straight, the chances that you're going to remember everything that you studied in those 4 hours is very, very slim. A lot of it's just going to go right back out. So take those breaks. Have a plan. Even if you're studying by yourself or with a group, have a plan of what you want to study. A lot of times I'll sit down before I actually start studying, and I'll write out, okay, this is my list of everything that has to get done this week. And then I'll go through, even though it's on my planner, I like to write it all out on a piece of paper, and I'll say, okay, this is due, if I'm sitting down Tuesday morning and I'm studying all day, this is due Wednesday, this is due Friday, this is due Saturday, this is due Thursday. So what do I know? Well, I need to get whatever's done Wednesday done today, preferably, if I don't have time to study tomorrow or whatever. So I know that that's one of the things I want to work on. And then I look at, okay, what else can I get done today or need to get done today that is going to be able to fill up, if I have 5 hours to study. So if I have 5 hours to study and I look and say, okay, I have discussion post due tomorrow in class, that'll probably take me about an hour, hour and a half. So I'll do that today. I don't have anything due until Saturday. I don't have a lot of days I'm in class or whatever, but I do need to read these chapters before class on Thursday. That's my next thing. So then I have 2 or 3 or 4, however many things that I know I need to get done that day. And then once I've gotten those 2 things done that have to get done, I go on and move down my list in relevance of importance, due dates, how long I think it's going to take something. If I'm working on like a course project that I know is going to take several hours, I'll work on it each day for a week for 20-30 minute intervals whenever I have time, whenever I'm ahead, just to get that done. But planning what you want to get done, feeling that sense of accomplishment at the end of the day can help too in feeling like it was a productive day and that you actually did get things done. It also helps you keep in line, keep you on track for your goals, whatever your assignments are due that week, and just keeping on track and staying focused and motivated. I personally find it very helpful to do something like that, and just planning on what I'm going to get done or what I'm going to study in a specific day. If a test is coming up, taking an hour out of each day. If it's really busy, an hour out of each day at least, or more, depending on how busy or stressful the week is or how many assignments you have, and studying ahead for that exam a week in advance. And that could be anything from rereading my notes to reading pages in the textbook to answering ATI or NCLEX questions and then topics that I'm kind of rusty on or not so sure on, going back and diving into that deeper. If I'm working ahead on that by a week, I have time before the exam, and I'm not sitting down the night before the exam trying to cram everything in my brain and remember things or memorize things the night before an exam, because that just is very stressful. The last thing I want to talk about, or that I can think of right now too, is in relevance to exams. Getting a good night's sleep the night before is so important. I cannot stress that enough. The night before an exam is not the time to pull an all-nighter. One, because the next morning, by the time you're going in to take that exam, your brain is fried. Your brain is shutting down. Your brain and your body need rest in order to remember things. Something I like to do for exams, because I do get extremely nervous before exams. Even if I, come out of the exam with an A, I most likely was nervous straight out of my mind. And something I do just to help is, first, I tell myself, and almost every time I take an exam, I can tell myself, I have done everything physically possible that I can do for this exam. I have tried my best, I have applied myself, I've taken time for myself at the same time, but I'm able to say that I have done everything I possibly can in order to get, whatever grade I get, and I'm fine with that. It might not be as good as I want, but I can confidently come out saying, yes, maybe I got to be on this exam, but I studied and did everything I possibly could to study for this exam. I will study the night before with my group of friends. I'll come home, kind of read over my notes or whatever I need to read over by myself, and then I'll go to bed, and I'll make sure I get at least 6 to 8 hours of sleep the night before an exam. Sometimes it's 6 or a little lower than 6, but I try and get at least 6 hours of sleep the night before an exam to give my brain a rest, to let it refuel. And then I wake up in the morning, probably a couple minutes earlier than I normally would, so that I have time to go and just look through my notes really quickly, kind of test myself, make sure that I'm confident in what I've studied, what I've learned, confident on the material, and then I go in and take my test. Not only does that kind of help with the nerves and seeing like, oh yes, I understand this. Even if I'm nervous on the exam, I don't know how a teacher is going to grade, I know that I know the material that I studied, I know the material that was given to me, and I've done everything I possibly could. Not only that, but it has been shown that whatever you are reading and studying the night before and you go to bed and you wake up in the morning, your brain remembers that information better. So that's another reason why I kind of have that pre-morning of a test routine. And in with that, I eat something for breakfast in the morning. A lot of times I have to drive an hour to my school to get to my school before an exam. And my exams start at 7 a.m. no matter what. They start at 7 a.m. I have to leave my house no later than 6 o'clock, which means I'm up at 4:35 in the morning just to get ready, and I'm up before that if I'm planning on studying. So if I'm carpooling with somebody and I'm not driving, I have that time in the car where we can quiz each other and ask each other questions, and that's my time to go over the information before the exam. If I'm driving, I personally can't focus on driving and focus on people who are quizzing me and stuff, so I like to get up like a half hour early just to read through my notes and feel a little more confident. So that's also, my suggestion on the morning of an exam. But definitely get plenty of sleep the night before an exam and read or eat something as well, because you may not feel hungry, but your body is under so much stress that usually once you sit down to take the exam and your body has calmed down and you're in the exam, your stomach's going to be growling, your brain is not focusing, it's more focusing on the food that it really, really wants, and you can easily get sidetracked during the exam. So those are just some of tips that I've come up with or people have asked questions about or whatever that I have found help when taking an exam, when studying, sorry about that, I thought I had turned my phone off. Just little tips and tidbits I found that help in preparing me and things that I found that work. And those are all definitely suggestions or things that I would suggest for you guys to try and see if they help you when you're taking your exam or just studying in general. So if you have any questions, please leave them in the comments below. Like this video if it was helpful, or if you found something that maybe you can use in your own studying, that you can pick up as a study habit as well. Just go ahead and comment below on maybe some of your ideas or things you use when you're studying. Thank you for watching this video, and again, let me know if there's any questions you have, if there's any video ideas you have, anything you would like to know, or maybe me go more in depth on. Just please leave those comments below. But thanks for watching, and I hope you all are doing well and staying positive through nursing school. Thanks.